Could you tell us a little bit about how you went about exploring your options?
Of course. So it's actually quite hard to get an F1 or an F2 job in a sexual health service. So I already knew that from the beginning. So what I decided to do instead was actually explore other options that I'd always thought I might like instead. So particularly in my F2 year, I was able to pick some complementary specialties. Um, so I didn't get all of them. I would have quite liked a placement in GP as well to see a bit more of that. But I did get a rotation in obstetrics and gynecology and decided to really, really throw myself into obstetrics and gynecology. And although I had a very good time as an F2 there, I knew that again, it wasn't quite for me. There were elements of it. So I was lucky to work in a service that had an abortion service. So I went and did some audits and some work in that service. But I knew that the obstetric side and the kind of high adrenaline side of obs and gynae wasn't really for me. I also then went and did a rotation in pediatrics and neonatology because again, that was something I'd been interested in from medical school. But again, it didn't the communication side of pediatrics didn't quite fit with what I really wanted to do because obviously a lot of your patients with pediatrics can't talk back to you. And actually, what I like about CSRH is it's a lot about kind of cooperative care where patients and doctors, you make decisions about people's care together, and that's not quite the same as in those other specialties. I did, however, also go and do a taste a week, and I would advocate that for anyone who's in F2. You are entitled to it on your study leave to go off and do a taste a week. So I went and did a taste a week at a local sexual health clinic, spent a lot of time working out my timetable with them so I could really get a perspective on all the different things that they did. In that time, I also met a CSRH trainee who was very helpful, but I also spent that time talking to GP trainees, gum trainees, so genitourinary medicine trainees, to see if actually those complementary specialties were something that I would want to do.